Integrating deep generative models with 3D digital humans in healthcare. The advent of data-driven technologies has significantly impacted various sectors, with healthcare standing at the forefront of this transformation. Among these innovations, the development of virtual humans, comprehensive, data-driven representations of individual health profiles, has emerged as a groundbreaking concept. Deep generative models, such as Variational Autoencoders, VAEs, and Generative Adversarial Networks, GANs, have made it possible to create intricate virtual representations by learning complex patterns from vast datasets. Parallel to this, advancements in 3D digital human modeling have enabled the creation of highly realistic and interactive human avatars. Integrating deep generative models with 3D digital human models promises to bridge the gap between data profiles and their visual counterparts. This fusion opens up a realm of innovative applications, offering dynamic and interactive experiences that can transform healthcare delivery, medical education, patient engagement, and more. This paper explores the technical aspects of integrating deep generative models with 3D digital human models. It delves into the potential applications of this integration and addresses the ethical and privacy considerations that are paramount in handling sensitive health data. By examining these facets, the paper aims to shed light on how this technological convergence can advance healthcare and related fields. Deep generative models have reshaped the understanding and utilization of complex data distributions. VAEs and GANs, in particular, have demonstrated remarkable capabilities in learning and generating high-dimensional data. In healthcare, these models can process heterogeneous datasets comprising medical records, lifestyle information, genetic data, and more, capturing intricate relationships among various health attributes. The Virtual Human Generative Model, VHGM, exemplifies the application of deep generative models in creating virtual human profiles. Utilizing a heterogeneous incomplete variational autoencoder, HIVE, the VHGM can handle diverse and incomplete datasets, making it adept at managing real-world medical data that often contains gaps. The masked modeling technique employed forces the model to learn how to impute missing values, enhancing its ability to generate comprehensive and accurate health profiles from partial data inputs. A virtual human, in terms of data representation, is conceptualized as a high-dimensional vector where each element corresponds to a specific physiological, behavioral, or psychological attribute. These attributes range from measurable health indicators like blood pressure and glucose levels to lifestyle factors such as exercise frequency and stress levels. Importantly, these profiles are dynamic, they can be updated with new data, allowing the virtual human to evolve over time and mirror real-world changes in an individual's health status. The probabilistic nature of deep generative models means that each attribute comes with an associated uncertainty, reflecting the natural variability and complexity inherent in human health. Integrating deep generative models with 3D digital human models involves several technical steps to ensure that rich data profiles are accurately and effectively translated into visual and interactive representations. Attribute mapping is the foundational step in this integration process. Each attribute generated by the deep model is associated with a corresponding visual characteristic in the 3D model. For example, a virtual human's body mass index, BMI, data can directly influence the body shape of the 3D model, while stress levels might be depicted through facial expressions or posture. This mapping requires sophisticated algorithms that can interpret quantitative data and translate it into qualitative visual features, ensuring that the 3D representation is both accurate and intuitive. Animation and responsiveness enhance the dynamic nature of the 3D model. By animating the model to reflect changes over time, users can observe the impact of health interventions or lifestyle modifications on the virtual human. For instance, if the virtual human's data indicates improved cardiovascular health due to increased exercise, the 3D model might gradually appear fitter and exhibit more vigorous animations. This dynamic representation provides a more engaging and informative experience, facilitating a deeper understanding of the interplay between various health factors. Real-time synchronization and bidirectional interaction are crucial for seamless integration. Changes in the virtual human's data profile should immediately reflect in the 3D model's appearance and behavior. Conversely, interactions with the 3D model, such as adjusting certain parameters or simulating interventions, should update the underlying data profile. This bidirectional flow of information allows for interactive exploration and experimentation, enabling users to visualize the potential outcomes of different scenarios. The integration process faces several challenges. Managing the heterogeneity and complexity of health data requires robust algorithms capable of handling diverse data types and ensuring accurate mappings. Computational requirements are significant, as real-time rendering and data processing demand high-performance computing resources. Ensuring scalability and robustness is essential to make the technology accessible and reliable for various applications. Integrating deep generative models with 3D digital human models holds immense potential across multiple domains, particularly in healthcare. Medical training and simulation stand to benefit greatly from this technology. By providing highly realistic and dynamic patient models, medical professionals in training can experience a wide array of clinical scenarios. These virtual patients can present varying symptoms, respond differently to treatments, and exhibit rare conditions that might be uncommon in real-world settings. This immersive learning environment enhances the development of diagnostic skills, clinical reasoning, and decision-making abilities in a safe and controlled setting. Patient education and engagement are enhanced through the use of interactive 3D models that visually represent an individual's health data. Patients can see a tangible representation of their medical conditions, understand the effects of different treatments, and visualize the impact of lifestyle changes. This visual and interactive approach can demystify complex medical information, empowering patients to take a more active role in their healthcare journey and motivating them to adopt healthier behaviors. In telemedicine and remote consultations, 3D digital human models can serve as avatars for patients, providing healthcare providers with a rich and interactive representation when physical examinations are not possible. These avatars can display real-time health data, symptoms, and other relevant information, enhancing the diagnostic process and communication between patients and providers. This can be particularly beneficial in remote areas or situations where in-person visits are challenging. Drug development and testing can be revolutionized by using virtual humans to simulate how different drugs interact with various health profiles. Researchers can predict efficacy, potential side effects, and interactions without the need for extensive human or animal trials. This approach can accelerate the development process, reduce costs, and improve safety by identifying issues early in the pipeline. Hypothetical scenario analysis allows both healthcare professionals and patients to model potential outcomes of health interventions. By adjusting variables such as diet, exercise, or medication, one can visualize how these changes might affect health over time. This tool can assist in personalized treatment planning and encourage patients to make informed decisions about their health. Integrating deep generative models with 3D digital human models raises significant ethical and privacy concerns, particularly regarding the handling of sensitive health data. Privacy and security of health data are paramount. The risk of unauthorized access to personal health information necessitates robust data protection measures. Strategies such as data encryption, secure authentication protocols, and anonymization techniques must be employed to safeguard data. Compliance with legal regulations like the Health Insurance Portability and Accountability Act, HIPAA, and the General Data Protection Regulation, GDPR, is essential to ensure that data handling meets the required standards. Consent and control over personal data are critical aspects of ethical data usage. Individuals must be fully informed about how their data will be used, who will have access to it, and for what purposes. Providing users with control over their data means allowing them to manage permissions, withdraw consent, and understand the implications of data sharing. Transparency in data practices builds trust, and ensures that individuals' rights are respected. The ethical implications of virtual human representations extend beyond privacy. There is potential for misuse, such as unauthorized simulations or manipulations that could lead to discrimination or stigmatization. Addressing biases in data and model outputs is essential to prevent perpetuating systemic inequalities. Additionally, interacting with one's digital twin could have psychological impacts that need to be carefully considered, ensuring that the technology benefits users without causing harm. Looking ahead, several areas require advancement to realize the full potential of integrating deep generative models with 3D digital human models. Technological advancements are needed to enhance model accuracy and realism. Integrating with emerging technologies like augmented reality, AR, virtual reality, VR, and wearable devices can provide more immersive and interactive experiences. Improving computational efficiency is necessary to make these technologies accessible to a broader audience, ensuring that they can be used on standard devices without specialized hardware. Developing policy and regulatory frameworks is crucial for guiding the ethical implementation of these technologies. Establishing clear guidelines for data security, privacy, and ethical use will help prevent misuse and protect individuals' rights. Collaboration between technologists, healthcare professionals, policymakers, and ethicists is essential to create standards that balance innovation with responsibility. There are numerous research opportunities in exploring new applications beyond healthcare. Education, entertainment, and other industries could benefit from virtual human technologies. Studying the long-term impacts of virtual human integration on society, health outcomes, and individual well-being can provide insights that guide future developments. Innovating in user experience and interaction design will enhance engagement and effectiveness. Integrating deep generative models with 3D digital human models represents a significant advancement in the representation and utilization of health data. By transforming complex data profiles into dynamic and interactive visual representations, this technology has the potential to revolutionize healthcare delivery, personalize patient care, and improve outcomes. It offers tools that enhance medical training, empower patients, and accelerate research, marking a shift toward more engaged and data-driven healthcare practices. Ensuring the ethical deployment of these technologies is imperative. Safeguarding individual privacy, securing data, and respecting consent are foundational to building trust and ensuring that the benefits of the technology are realized without compromising personal rights. A commitment to responsible development and adherence to ethical standards will be essential in navigating the challenges that accompany such transformative innovations. As we envision the future, the integration of deep generative models with 3D digital humans stands as a testament to the possibilities that arise from interdisciplinary collaboration. By fostering a collaborative ecosystem among technologists, healthcare professionals, researchers, and policymakers, we can continue to advance this field responsibly. Ongoing dialogue on the ethical and societal implications will be crucial in shaping a future where technology enhances human health and well-being while upholding the values of dignity and respect.